Hey, this is Dr. Sam Benjamin, News Talk 92.3 KTAR, Primary Care. Saturdays, by the way, from 4 to 5. I hope that you're going to join me. But I want to tell you about a couple of things. First thing is something that's kind of happened recently. It's about the drug Lyrica. Lyrica is used for people who are diabetics or perhaps alcoholics that have peripheral neuropathy. That means that the nerves on their legs, their hands, maybe even on their body, for some reason has become inflamed, the blood flow is inadequate, and as a result of that, they're getting burning, tingling, pain, shooting pains. It's sometimes almost intolerable and impossible to live a normal life. Lyrica has been touted as one of the typical drugs to be used for this. Doctors prescribe it all of the time, yet the fact of the matter is this new study, supported by the manufacturer, Pfizer, shows that it really doesn't have very much value. Now, that's very important. It's important to know that oftentimes we doctors prescribe things where we don't have enough evidence really to support the reasons that the drug is being used for. I recommend, if you happen to be in that position, to take intravenous alpha-lipoic acid. It is used by the Germans and by all of Europe frequently for these diagnoses. It really works well. I use it in my office all the time. Patients do great. I'm not surprised that Lyrica is not adequate. By the way, there's another one, gabapentin. Works okay, but has a lot of side effects. I would still use alpha-lipoic acid if I were you, taking it IV and then afterward getting it by mouth. So for whatever it's worth, if you have these problems, there's hope, things you can do. I want to switch gears because I want to tell you about a problem we have. I wrote a blog about this here on KTR.com, and it has to do with what we physicians need to do. We need to get back to being healers. We need to get back to dealing with you. We need to get back to advocating for our patients, and we need to get back to being the friends and supporters of our patients. That's what I feel. I feel like I'm a fan of my patients. We all should feel that way. We've been deterred from this by paperwork, by federalization, by lots of lawsuits, by things that are said in the media, but the fact of the matter is that most of us wanted to be healers, and to heal, we need to be sensitive to what our patients have to say. I have a patient in her mid-40s. She has a rare skin cancer, a skin lymphoma. After the diagnosis was made, she was sent to a dermatologist, but perhaps I should tell you one thing before. She sees this doctor, diagnosis is made, a cancer specialist. Doctor says, hey, you know, I really feel lucky. She says, why? He said, well, very few oncologists, cancer specialists, get to see this kind of patient, what you have in their lifetimes. And she just wondered, what was lucky about that for her? Why would the doctor even say that? If you're a doctor, don't you think we should be keeping those things to ourselves? Now, second thing, she goes to a dermatologist, skin specialist, gives her a cream, said, you're going to have to take this cream for the rest of your life. And she says, okay, thank you very much. Runs out of the cream after X period of time, goes for a refill, there's no refill. She's sensitive, depressed, frightened, question in her head. Did the doctor say, use this tube for the rest of your life because that's about as long as she was going to live? Shouldn't we have been sensitive to the fact that she needs to have refills and that we need to assure her, explain things out, not be so brief? Don't we need to spend more time with our patients? Last but not least, doctor says in May 2012, hey, I think you may have some spread of this into other organs in your body. In order to control this adequately, we need to get you as soon as we can back to the cancer specialist. May 2012, diagnosis, skin cancer, skin lymphoma. When was the appointment made for? The end of August of 2012. Where's our sensitivity? What's happened to us? Well, all I can tell you is this. We need to get back to being We need to get back to listening. We don't need to get back to being anything. We need to listen to our patients. We need to remember that we serve them. And we need to try to forget about the federal rules, the legislatures, Obama, Romney. They're out to save money. We're out to save patients.